So these are the insertion points I use for cannulas. One of my main go-to insertion points is the intersection here with here. Okay, it's about 1 centimeter or right near the lateral canthus and the nasal ala, right here. This is your workhorse. This can get into the medial cheek, but it also can get into the tear trough and the lateral tear trough. And you can bring it back and even get the zygoma, the cheek. And then you can turn it forward and get into the piriform area. So this is my workhorse. I use this almost every day on every patient. If you want to get the temple area, I usually choose a point between the brow and the hairline along the zygoma. So this is where I insert to do the temples superficially. This can get the temples, which is here, but it also can get the brow, the superior orbital rim, and the supraorbital area right here, which often needs filling because there's a fat pad there. And you can get past the temporal fusion line with the longer cannulas. So another area of insertion is in this point here. So this is for your elderly patients who need to improve the jawline, to have a jowl. You do it at the lowest part of the jowl, underneath the jawline, and this way you can put filler back here and turn it around and put filler here, as well as into the chin. So this is a great insertion point for your elderly jaw patient. But for your younger jaw patient, you can actually put the insertion point back here at the angle, at the gonial angle, and you can get along the jawline, okay? This is along the jawline, whereas the older patient is below the jawline. So that's a good insertion point. And then to enhance the ramus, the ascending ramus, you can also do that from this point too. So another pilot insertion point I use is about right here. Okay, so this can get the lips, and it can get the nasolabial folds as well as the piriform area, but then you can turn it down and get the marionette area as well. And if you like, you can also get the chin. So from very few access points, you can get almost all the areas of the face. One other area I use, so sometimes I need to get the preauricular, and this sometimes doesn't make it all the way back, so I do an insertion point right here, and that gets the preauricular area. So the preauricular area has fat that gets lost, especially in patients who are athletic, and as well as facelift patients. Facelift patients get a lot of fat loss in this area because of devascularization. So you can insert it here and fill the preauricular area. Keep in mind that the temporal fat pad goes down here and the lateral. So if you have loss in the temporal fat pad up here, you also have loss in the preauricular area. So to do the forehead, there's 2 insertion points I use. I use one near the temporal fusion line, which is kind of like right here. And you can get most of the forehead from this area, okay? You can also do an insertion point up here, and this can get the medial portion of the forehead as well as the glabella area. There's one other insertion point. If I'm going for marionettes and nasolabials, I also use an insertion point right here. And that way you can get the marionettes, but then turn it up and also get the nasolabials. About sterility of the cannulas. So we use HIPAA and sometimes we use alcohol in combination, but you should never touch the cannula, or you should never touch the gauze with the end of the cannula before you insert it in the patient. The other thing to be careful is I see a lot of patients that are treated and the physician is rubbing it against their glove. Their glove's not sterile, so you don't want to contaminate the tip of the cannula. You also don't want to insert it like this because you're contaminating the tip. So sterility of the cannula is very important to minimize biofilms and later infections. So this is the Easy Guide system from Softfill, and it's a great system to insert the cannula. And I'm going to do her marionette area using Refine. So I'm using a 25 gauge cannula that's 40 millimeters. And when you insert the Easy Guide, you go tangential to the skin, almost. So you barely are getting into the skin. You don't want to go too deeply because that will disrupt vessels and that will be the cause of bruising. Then you put the cannula through the Easy Guide system and you get it into the skin. And once you're into the skin, you remove the Easy Guide system. Okay, and then I do something called the twist. Okay, do the twist. The twist helps you insert the cannula much easier than just pushing. So do the twist. And in this patient, we're using Refine because we don't want to give her much volume. We just want to do a little myomodulation here and give her very little volume. Refine is great for that. And so I do a little tunneling, a little twisting, and I always do a retrograde technique using Refine or all my products. I'm going retrograde. I'm laying down a small, thin layer of filler. The other thing you notice is that before I make a difference in direction, I'm almost coming out. Do you see? I'm almost out of the skin. And that way I form a different channel. If you don't do that, what happens is I want to go, let's say I want to go lower. Look where I'm going. The cannula is still going into the same spot, but it's bending right here. So always come almost all the way out before you change direction. Okay? And I'm doing this fairly superficially, retrograde technique. There should be minimal discomfort and minimal bruising. There's a pseudotendon from the DAO, the DAO muscle, depressor angularis oris, that attaches to the skin. And that's the resistance I'm feeling. And some people believe that doing a little subcision of that helps improve the marionettes. So there's half a syringe of using Restylane Refine. You're inserting a cannula in a prior pilot hole. You do a little tension on the skin and that steadies the hole. And you go in the same direction as you made the pilot hole. If you want to go up here, for instance, you go in the same direction and then you redirect. And look, do you see that? That's an error. I'm pulling a little bit of tissue from the lower area into the upper area, and it's giving me a little tension and it will hurt the patient. So what you do then is you bring it back out a little bit and you'll see that now, I gotta bring it back even more, that now there's less tension. And I'm using the other hand to help me, okay? Sometimes an assistant helps. So let's do it again. Through the skin, and now I'm going up using my smart hand. This is my smart hand, and I'm helping to insert the cannula into the nasolabial. You always know where that tip of the cannula is by feeling it with your smart hand. And I'm helping the cannula up there with this other hand, okay? So it's very important to use two hands when you're using cannulas. If you want to get into the tissues that are deep, and for instance, the pilot hole is made this way, it's much better to lift the tissues up. It helps you get into the deeper tissues when you pinch the fat. If you want to get superficial, you spread the skin. So if you want to go deep, you lift up this fat and you can go under the fat very easily. Superficial, you spread it and go in. Here's another point. When you're inserting the cannula, you are always at the hub. You have much more control here than you do back here. So when you insert the cannula, you're here, stretching the skin, inserting it into the pilot hole. Okay, so do you notice that the cannula is very straight? If the cannula starts to bend, you are not becoming one with the cannula. You want to create a zen with the cannula. You want to be one. You and the cannula have to be one. Not like this, okay? That means that you're losing control of the tip. You want to have complete control and it has to be straight. Part of the safety aspects of using cannulas is constantly moving the cannula. So if I'm here, I am constantly moving the cannula in and out of the areas I'm injecting. I am not staying there and bolusing. Bolusing can get you into trouble if you're in a vessel. Also, it's more important to be perpendicular to the vessels if possible, because then the time that you're within a vessel is going to be less than if you are parallel to the vessel and you happen to get in it. You can be along the vessel and inside the vessel for a very long period of time. So the safer way to inject the piriform area is probably an injection like this, because I'm perpendicular to the angular artery. But this way is safe too, as long as you keep moving and not bolus. So why should you use cannulas in the first place? Why? Needles seem to be a lot easier. The cannulas are going to make the patient experience much better. Why? Because there's only usually 1 or 2 insertion points in a patient, and most of the discomfort is when you enter through the dermis. So with needles, you have multiple insertion sites, more discomfort. Also, there's going to be less bruising for the same reason. You're inserting through the dermis in a lot less areas, and the cannulas will bounce off the subdermal vessels a lot easier. The needles will just pierce it. So you'll leave more bruising and more chances of hematoma. But the most important factor with cannulas are, I believe, that they're safer. It's not been proven in head-to-head studies, but that's very difficult to prove. But I believe that the entry into a vessel with filler is going to be less when using cannulas than when using needles. The reason being is that the end of the cannulas are rounded and blunt. So it's going to be very difficult, not impossible, to enter a vessel with a cannula. Also, I like to use larger cannulas because the larger cannulas are going to have a harder time entering vessels as a smaller cannula. As previously explained, the 27 gauge cannula is just as sharp as a needle. Don't even bother using it. So those are my reasons to use cannulas. So part of the decision-making tree when you're using cannulas is what size cannula, meaning gauge as well as length. So these are my 3 go-to cannula sizes. I have a 23 gauge cannula, a 22, and a 25. These are soft fill cannulas. So the 25 and the 22, they come with the Easy Guide system, which gives you easier access to placing the cannula. So for the 25, I like the 40 millimeter XL soft fill cannula. The reason being is that when you go to 50 millimeter, it's a longer one, it's a little too flexible and the resistance increases a little bit. But when you go to the 22 gauge cannula, which is a big workhorse right now, you can go to a 50 millimeter or even longer. And the resistance, even if it's longer, is not that much. The 23 gauge cannula is great. I use it for Sculptra, but it doesn't come with the Easy Guide system, and you can use a 40 or a 50 millimeter length in that. Keep in mind that patients don't really notice a big difference in discomfort when you use a larger gauge cannula. So larger gauge cannulas can be used for everything. So these are my go-to for these Restylane products. So for Restylane Define, I usually use a 22 gauge 50 millimeter soft fill cannula. Restylane Define is the thickest of all the products, Restylane products, and I've had the tip blow off when I'm using 25s and even 23s. So the 22 gauge cannula is needed for the Restylane Define. For Restylane Refine, 25 gauge cannula is fine. I use a 25 gauge 40 millimeter. It helps me insert it into the lips very easily. For Restylane Silk, you can use a 25, you can also use a 27, but here's the caution. There's a recent article that stated that the 27 gauge cannula is just as easy to enter a vessel as is a 27 gauge needle. So there's no reason to ever use a 27 gauge cannula anymore. It's not any safer than a needle, and so sort of the advantages of cannulas are thrown out the window. So for Restylane L, I typically will use the 25 gauge cannula, and for Restylane Lift, either 25 or the 23. So those are my go-to cannulas for Restylane products.